Hi, my name is Hank Eagling. I'm an ACSM certified personal trainer. Today we're here at Train Chicago Studios. Today I want to welcome my friend Mike Kelly, physical therapist, best in the city of Chicago. I wanted Mike to answer a couple questions today. I get a lot of people that ask, when is the right time to see a physical therapist or a doctor? They have injuries, issues, and they're not quite sure who they should see, when they should see him. So I brought Mike here today to kind of answer those questions for you guys. So go ahead, Mike, take it away.
It's a common question. I work with a lot of personal trainers, and one of the jobs I've done over the course of time is teach them when they should be looking to send people in to see doctors, physicians, and physical therapists. And the thing I found to be the case is you need to look at it, your injury. If you're listening to this today and you can classify your injury usually in a couple different categories. There's acute injuries, something that happened recent, traumatic, within the first 3 days after you start feeling it. There's subacute, usually in the first 2 weeks you're starting to feel things. After that, things start going into a chronic phase. So if we break down the three different groups, let's talk about those acute injuries. Well, if you fell or you have any sort of quick impact problem, I encourage you to see a physician, especially based on this video and the fact that I haven't done an examination of you here today. If you have something that's very painful, if you had a pain scale from 0 to 10, that's greater than 6 out of 10, and you just had a traumatic injury or you're a pop or anything that you're questioning it, why not take care of yourself? Please see a physician. Subacute, something in the last 2 weeks, and you're wondering, hurts a little bit, and should I see a doctor or not? I encourage you, please take down your exercise by 50%, maybe take a break for a few days, see if it resolves, see if you can take some ice, some sort of anti-inflammatories, Advil, leave at home. I'm not prescribing those to you today, but that's what I would recommend. And see how your symptoms, if you're seeing a resolution of your symptoms in those next 2 weeks, then good, keep up what you're doing, see how things resolve. Now after 4 weeks, you start hitting that chronic phase. You want to be thinking more along the lines of, okay, I have a real injury that's not resolving. You have a chronic injury. If it's not changing, the symptoms are the same day to day, same thing you do ever causes pain every single time, you need an intervention. What that intervention is could be a number of things. But I encourage you to see a physician so you can get a full analysis, get evaluated. Do you need further physical therapy? Do you need some sort of diagnostic imaging? Can they do some sort of intervention for you when you're at the physician that day? I encourage you to look out for some sort of sports medicine physician or orthopedist to do so. You can also get a free assessment by many physical therapists here in the city of Chicago. You can call like a local office and talk to them. So in general, acute injuries, physician, subacute, try to self-manage, talk to people. You can look at things on the internet, see if it matches up any sort of diagnosis that you can find and try to do some things like that. And chronic, I would see a physician. Overall, I'm going to give you a caveat. When in doubt, see a doctor. This is purely based on the video. I don't have your specific case in front of me, so I can't specifically tell you what to do, but hopefully that gives you a little bit of a framework on what you should do.
Great information, guys, here by Mike Kelly. Hopefully that answers some of your questions. I want to thank Mike again, and now you got it. Go dominate.